Well, back with Dr. Zaibak. Dr. Zaibak, tell us, some of us patients, we sometimes have a missing tooth or two or three or more, and especially when we have those missing teeth in the back, we somehow, nothing really bad seems to happen sometimes, and we tend not to fix it. In front, that's a different story. We look ugly, so we go and fix it. But in the back, not so much. And yet, dentists like you keep telling us you must fix it. If you don't, all hell breaks loose. Why this discrepancy? Why do we patients really not feel all that bad about it? Doesn't seem to be hurting us. We seem to be just fine, and yet you dentists are stressing to fix it. Can you shed some light on that, Dr. Zaibak?
Sure. Think of it as kind of like a book of shelves. If you have a bunch of books stacked next to each other, and you remove a book or one of the books is missing, what's going to happen to the rest of the books? They're all going to start leaning on each other. Teeth support each other. It's all like a puzzle that all fit each other. If the back teeth are not functional, you're going to put a lot of stress on the front teeth, which will eventually cause them to fracture and break. Therefore, the back is mandatory because it's for mastication, which means chewing your teeth and breaking down the food. And the front is mainly meant for incising and obviously smiling and so forth.
Okay. So when those teeth are shifting, so you already have a tooth or two missing in the back, doesn't seem to bother you too much. So the next tooth shifts a little bit, just like a bookshelf, maybe even a bookshelf behind me. Things are a little crooked in it. So what? What's the big deal?
So it's going to start affecting your anterior teeth that you're worried about. It will eventually give you gum problems, pockets, which will eventually make you lose one tooth and then another tooth, and eventually you're going to end up getting a denture. That's why our grandparents have dentures, because that was their mentality then. Most of our grandparents, most of the older generations, they end up having dentures and partials and removable prostheses. And the reason being is the idea was if no one sees it, it doesn't matter. As long as it's not in front of your mouth.
Well, you said something about the teeth start shifting, and you mentioned the bookshelf, and when you mentioned that, I kind of like, what came to my mind is it's kind of a fence, which some of the balls, they start getting a little crooked, and so they lose its aesthetic, of course, and they also lose the functionability. Every little dog can come in and out, and it looks ugly. When that happens, and you said something about people starting to grind their front teeth, use them different, does that maybe have something to do with also that your jaw, maybe the DMJ here, the hinges, I call them, overall it gets out of alignment, and that then because of it, some of the muscle tensions in neck, shoulders, etc. come in?
Well, let's think about it. If you have more teeth on one side of your mouth than the other one, which side in general you think is going to take more forces when you're chewing? It's the side that's going to have more teeth. So that side is going to have more pressure on the muscle, more pressure on your joint, your TMJ, what we call, which eventually may develop into muscle aches, TMJ problems, periodontal disease, and so on, and teeth fracturing, and teeth abrasion, and and then the size of your teeth starts to become reducing because it's uneven. God gave us a certain amount of teeth on each side for a reason. If we neglect them, then we're going to end up having less teeth than we'd like. And you're putting more pressure on one tooth versus the other, and eventually you will lose that tooth because each tooth has a certain amount of pressure that it's supposed to handle.
Mm-hmm. So you said muscle tension. So that is something which can and will happen, muscle tensions. How far do those muscle tensions go? Can they go up all the way to a headache, down to a neck, shoulder, even back pain? Or is that a little over-exaggerated? What are we talking here in terms of tension because of the joint here, the TMJ? What are we talking here? How severe can that get for a patient if he doesn't have his mouth aligned?
I mean, the whole body is connected together. The muscles that close your jaw and open your jaw are connected to your head, your temporalis. So you can definitely get headaches. You can get headaches, you can get earaches, muscle spasm, neck pains, and so on. I mean, if everything is not aligned correctly, then the whole body is going to be
So it's a little bit like with feet. When you have maybe a bunion or otherwise walk crooked with your feet, next thing you know is your knees need surgery, maybe even your hip and your back. And so the same, what you're saying is actually happening with your jaws. If it is not okay, it starts moving around here. And obviously people are rather fragile around their head. So it looks to me that, tensions in the neck and the shoulder, headaches is as or more devastating than maybe not chewing correctly. That the person might not realize he's doing, but he might be running around. So tell me, if a person has missing teeth, but maybe even if not, because there's probably other reason to get your jaw misaligned than having missing teeth. But if he has a headache, shoulder pain, and he tried it with a chiropractor here and there, did a few things, but hasn't yet visited a doctor for adjusting the jaw, TMJ, would it be a wise thing for him to go to a dentist who knows about that, to fix it or eliminate the cause of it? Would that be a wise action for him?
Of course. Again, as I said, Mr. Flash, everything is connected. The whole body is together. You can get back pains, you can get jaw pains, everything is interrelated. And it's a very wise idea to, if you have headaches and if you have earaches, to go to the dentist and take x-rays and evaluate the situation, because it could be a root canal. A tooth that needs a root canal can cause you earaches and can cause you headaches, as well as obviously TMJ issues, which can be as a result of either one bad occlusion, a bad bite, or missing teeth that can give you a bad bite.
Well, Dr. Zaibak, thank you very much for your candidness and for your very good information. Bye-bye.
Thank you.